Okay, I think we can start actually. Hi everyone, good evening and welcome to this session. Thank you for joining us this evening as we discuss cancer well-being, which is something very vital and probably often overlooked in the grand scheme of things about treatment, about getting better, between the news and what do we do and how do we do it. With us this evening, we are privileged to have two amazing speakers who's been operating in this space for a long time and, have been able to have a support group and facilitate it with amazing results. So we'll be learning from them this evening. And please, as usual, make sure you have all your questions ready because it's going to be interactive. We're going to give you the opportunity to ask questions. If you have any comments or you want to get in touch, involved in the discussions, please put them in the comment box. We'll go through everything. We'll make sure we all get something valuable from this session. My name is Mary Akongbe, President Zenith Global Health. A bit about Zenith Global Health is a platform set up for collaboration, share learning, and skills transfer. And on top of that, we celebrate the achievements of amazing people, healthcare professionals, for the groundbreaking work that they do and the selflessness, because I mean, it's not what they get is nothing compared to the amount of effort that goes into what we do. So we had on that platform, we celebrate, we acknowledge, and again, we network as well. There's been so many partnerships formed multidisciplinary from all of our events. Let me introduce to you Dr. Kate Harrison, who's a consultant psychologist, and Rachel Bunn, who is a well-being lead and specialist review radiographer. Yeah, I got it. This is just to tell you their names and to welcome them. Thank you so much for joining us. And when they start the presentation, they are going to formally introduce themselves to you and tell you more about what they do. Let's see if I can do the pause before. Because if I let Kate share first, the answers may be in your presentation.
Okay.
Yeah.
Okay. Great.
So,
thanks.
yeah. So to warm up and also to get us going, we're going to have a little bit of exercise. Okay. So on your screen right now, on top of the introductory page of the webinar presentation, you should see the polls coming up. So the first one is the percentage of carers of cancer patients that experience anxiety. If you can just choose one of the answers, please. It will help if I launch it, actually. You can tell I'm really excited about this evening. So please choose your answer. And the second one is the psychological support, either in a group or one-to-one, can enhance patients' well-being. They are all multiple questions. Oh, shall I? I'm sure people can see that. No, we're doing great. Okay. Oh, they're ahead of me. Okay. Kate and Rachel, can you see the poll?
I can, yeah.
Yeah.
Okay. You can, okay.
Can't see the results yet.
Oh, you can see, okay. Oh, it helps. Okay, 30 more seconds and I'm going to end it. Okay, so question 1, percentage of carers of cancer patients that experience anxiety. 76% says 70%. 24% says 67%. So what is the correct answer?
67.
67.
So 67 or 70 is fine. Yeah.
Okay, yeah. So we take that. I mean, I think that was too close. It should have been something like 90 and 67. Okay. Thank you, everyone. That's amazing. Wow. Question 2. Everybody agrees. I suppose that's why we are here today, to learn more about the impact and the positive way that supports can, influence the outcome. Post-treatment emotional and psychological effect of cancer treatment can last as long as 24% says 5 years, 24% says 12 years, 53% says 10 years.
Yeah, so 54% of people after 10 years still have some psychological effects in terms of after the diagnosis.
Okay. I mean, I think with this one, the most important thing is that it lasts a long time. So between 10, 12, thank you, everyone.
Yeah, and physiological effects can last, any amount of time. They can last longer than that.
Okay, all right. Number 4, depression can increase mortality rate in cancer survivors by as high as 39%, 24% says that, 50% says 47%. No, I'm reading it the other way around. 24% says 39%, 47% says 50%, 29% says 48%.
So yeah, mortality is 39% higher in cancer patients who are suffering with depression.
39%. Okay. Yeah. Somehow it's not moving. Okay, thank you very much. That's the end of it. Great job, everyone. And thank you for doing that. So we'll hand over to Rachel now.
So just going to thank you, Mary, for the introduction. And I'm just going to speak a little bit about who we are. So my name's Kate Harris and I work as consultant psychologist at the Christie Private Care. And Rachel works alongside me running the Wellbeing groups and also as a radiographer. So in terms of what we're going to do today, we are going to show you how we deal with people who are traumatized by being diagnosed and treated for cancer. And we're also going to show you some of the tips we talk to people about in terms of coping after treatment has finished. Between us, we have nearly 30 years of experience, and we also help relatives because they suffer vicarious trauma. So we're going to show you the challenges of having cancer during the current pandemic, and we're also going to show you how you can potentially help yourself, or potentially how you can help someone else. And these are things we've learned through working with people who are affected by cancer. So the agenda today is understanding the challenges, treating people as individuals and holistically, building resilience, types of coping strategies, and a brief sort of talk about coping with the fear of cancer coming back. So now I'll pass over to Rachel.
So I'm really lucky to be in a position where I work clinically and I run the wellbeing service as well. So that's given me the opportunity to ask both people at the wellbeing and patients that we treat a little bit about their experience of going through cancer treatment and diagnosis alongside us going through a worldwide pandemic. So just wanted to put forward a patient's or carer's voice, as you will. Common words that we used when we got this feedback were isolation, fear, increased anxiety, frustration and sadness, amongst many others. I don't know if these feelings resonate with people. Themes included anxiety and fear around the possibility of delayed diagnosis or delayed treatments, the anxiety of having to come and attend appointments on their own and come into the hospital on their own, not having their moral support with them, the fear of catching COVID, so the worry about if they would be really poorly with COVID, or if they got COVID, whether that might delay cancer treatments or they wouldn't be able to access them. A lack of support facilities, as places had to learn how to work in different ways, so facility support wasn't available quite so easily, and the fact that family and friends weren't able to come around to the house, and they weren't able to go out and be with people and get that social interaction. And not being able to plan, so not being able to think, when I get through this next treatment, I'll have a holiday, or I'll go out with such a body and have a nice time. So, you know, just some things that people were saying. So I just wanted to go through some of the quotes. So one lady saying, it's really hard remembering what had been said in a consultation, so that I could tell my husband all about it. Walking into the hospital for surgery, no husband holding my hand, no last connection. Anxious as there were delays in diagnosis with access to GPs and ENT referrals. All the time the pain and the cancer was growing. Nobody wants to go near your mouth. Mine was a head and neck cancer, and I was told that I couldn't be put forward for a really promising trial because it had been delayed due to COVID. And the most terrifying thing, and everybody said this really, was being dropped off at a cancer hospital alone. So these are all the things that people were saying, but alongside that, everybody recognised as well that, you know, the restrictions and the way that things were being managed were put in place for safety, and people felt really safe in coming to the hospital, but these things are obviously there in the background. And the next slide. So the next two bits of comments are from some people that come to some support groups that we run. The first comment is from somebody who comes to our Living with Incurable Cancer group. So these are people that you know they've got a fairly finite amount of time left. So this gentleman has fed back, my cancer is incurable. I know I have a limited amount of time left. Whilst I am well, I want to be able to do things and live. I can't leave my house at the moment or see my family and friends. The next quote is from a lady that comes to our Significant Others group. So we run a group for partners of our patients that come to the Incurable Cancers group, basically. And we know that partners find it quite hard to access support. They sometimes get a bit left out. They see themselves maybe as not being worthy of accessing the support. So this lady had said, not being able to attend hospital appointments with my partner who is going through it. I don't know what is being said. I can't be the second set of ears or be there to ask questions. I don't know how best to support him. And we know through research that typically people take in about 40% of what's said in the consultation. And so, you know, having that second person there is really good for the patient and for the partner as well. And that was being lost. Next slide, please. So side effects of treatment. So treatment for cancer are always improving and becoming more targeted and permanently ongoing research and developing. And Macmillan states that the statistics at the moment say that there are over 2.5 million people in the UK at the moment that are living either with or beyond cancer. And these figures are going up by about 3% every year. And what that means is that we've got all those people that are you know, living with chronic cancer side effects that are ongoing for them. So some of the things that are there for people are fatigue. So fatigue from cancer treatments isn't being a bit tired, having an early night and feeling better the next day. It's a continuous tiredness that is hard to get rid of and feeling, you know, completely shattered all the time. Urinary and bowel problems. So this can be people being incontinent, and this can last for years and years, or it can mean severe frequency and severe urgency. So people have to plan their lives around that. So if they're going somewhere, they need to know there's a toilet there. They need to know where they can stop on the way there to use the toilet, and the fear of soiling themselves and being anxious about that. Joint pain comes about from a lot of medication, and that's something that people just have to live with and get on with for the rest of their life. Lymphedema is a side effect of quite a few treatments and is really uncomfortable. Menopause, again, can be caused by some treatments, by some drugs. And so you're going through everything that you're already going through. You've got other side effects, and at the same time, you're launched into full-on menopause. So, and then losses as you go through things. So people lose hair, they lose plans, they lose friends as friends change and roles change. Intimacy can be affected because there's this change in function, there's loss of time to be with a partner. And we've had some feedback recently that when people are trying to gain some intimacy back and be with partners a little bit, that in actual fact, because of COVID, they're locked in the house and they can't go out, and they're locked in with the children. So that kind of COVID has got an impact as well. And then the thing that we see, that I see in radiotherapy actually quite often, is that people get to the end of treatment and everybody goes, oh, wonderful, that's really exciting. But in actual fact, people find that really difficult quite often at the end of treatment. And the feedback that I've had, that people have said to me, is that when you get diagnosed and you're going through treatment, you very much head down and get on with it because you've got no choice. And once treatment has finished, everything can start to catch up with you and you start to reflect. People feel like they lose the safety net of coming to the hospital and having those frequent appointments and regular contact. And just everything starts to catch up, and it can be a really difficult time. Okay, next slide. So one of the things that we can do to support this is we do this through our wellbeing groups. And this is about treating people as an individual, not as a diagnosis. And we do this through one-to-one psychological support and through cancer wellbeing groups. And that gives people the support to enable them to move forward and to empower them with new information and confidence. One of the big things recently, so it's always been about being with other people in a similar situation, but especially with COVID, actually being able to have that human connection and talk to people who get it. So people say, you know, it's not the same talking to a really good friend or even a partner. If you haven't sat in that position yourself, it's really hard to understand where people are coming from. So we support on things like recognising and managing treatment-related side effects. So knowing what is a chronic side effect, knowing who to ask and how to get some help for it. We talk about exercise and diet support. So exercise research shows that this is a really integral part of starting to move on and starting to heal. We talk about diet support because there are lots of myths out there in social media and in the newspapers about what you should be eating and what you shouldn't be eating when you've got cancer. So we use some expertise, oncology input, dietitian input, just to talk about the myths and sort out, what's good and what's bad. We talk about relaxation techniques and coping strategies. And this is for people if they're waiting for scans or they're waiting for results, or when their mind's going mad in the middle of the night, and just to try and help them manage with that. We have a good session, a long session on intimacy and sexual function, where we talk about what's normal and we talk about some strategies to put in place and some medications to use. And it's all really, a lot of it is about providing contacts and signposting for ongoing support. And we quite often talk about return to work and how to support people doing that. So they've got some support doing it and they know to contact if they're having any problems. We have the group for significant others, which is the one that we just mentioned before. And this is for people whose partners are going through treatment. Again, just to be with others in a similar situation who understand where they're coming from. We tend to have a really good giggle, and we tend to talk about some really tricky stuff as well. So it's just being together really. And then the other group that we mentioned before is for people with metastatic or incurable cancer. And again, very, very similar, just nice for people to be together who understand where they're coming from. We don't even necessarily talk about cancer all the time. It's just that people have got that genuine bond and that understanding of each other. And that's me.
Thanks, Rachel.
Thank you.
So just going on to, we're going to do 10 minutes now on resilience and coping strategies, and I'm going to present this part. One of the first things to say, and this has been fed back to us a lot from people affected by cancer, is what people feel is a complete out of control feeling when they get diagnosed. And we have a deep need as human beings to have a sense of control. So this is a very uncomfortable feeling that people have, and it makes them feel on high alert. And sometimes people feel quite powerless with regard to their diagnosis. Now, in terms of human beings, we are wired to survive, and therefore our threat system is very strong. So when we get a life event, like someone passes away or we are diagnosed with an illness, our deep subconscious releases stress hormones like adrenaline and cortisol. and we go into fight, flight, freeze, where we're just stuck, or we submit and give up. So the evolutionary response is very strong, and it's strong for a reason, because what the brain is doing and the mind is doing is it's trying to scan the environment for more threats. So often when you get a cancer diagnosis, people are on high alert with adrenaline and cortisol racing around their body. So it's a very uncomfortable feeling that people have. And with COVID-19, that is not helping anyone in terms of feeling quite anxious. So we're going to just go through a few pieces of advice we've learned from the groups and from working with people on a one-to-one basis. We won't be able to cover everything, but it just gives you a flavour of some of the strategies that we try and help people with. So the first thing to say is what we try and do is we try and build people's resilience. Sometimes it's hard for us to build resilience because we may feel we don't have personal control over our life, we don't have social support, or we might have had early experiences where we have been neglected, or we haven't had parents or caregivers who were very emotionally tuned to us. So we might have experienced criticism or emotional neglect growing up. And also, if we've had acute trauma in the past as an adult, having a diagnosis of cancer can bring other traumas back. So if we've lost someone from cancer in the past, for instance, this can mean that can make us feel pretty scared. And again, our prefrontal cortex can be offline. So resilience can be low. So one of the things to know is that this is really important, resilience, in trying to help us move forward when we have a big life event. And it's the single most thing that can actually improve our quality of life. And how I would describe resilience is it's endurance, but it's also with direction. So what you're not doing is bouncing back from the trauma. What you're doing is integrating what's happening to you, these hard experiences, and finding healthy ways to move forward with your life. So no one can build resilience for you, and you might feel that you've had a past which hasn't given you a lot of resilience, but you can help yourself with certain coping strategies to try and build your resilience. In terms of building your resilience, it's about managing stress as well, because if we're constantly stressed out, our resilience can be at low ebb. So we can be like a car running on empty fumes. So it's important that you actually get rest, and also that you manage your stress. So 4 types of coping strategy we're going to talk about, because in life we can't stop the waves coming in, and this is a quote I really like: we can only learn to surf the waves. And that means we can't stop stresses and strains affecting our life. And certainly if someone's been diagnosed with cancers, there is a lot of scans that potentially have to be done, or lots of types of treatment, or you might be watching and waiting for things to develop or things not to develop, and all those things are going to be very stressful. So we can't stop that, but it's about how we deal with those. So there's 4 types of coping strategy. The first one is about trying to resolve the stress by changing the way we think. So this is appraisal focus. So we try and talk to people about how we can reframe their thinking to be more helpful, not deny the fact of what's happening to them, but how we can try and change their cognitions to be more helpful. And I will talk further about that. The second one is using emotion-focused coping strategies. So this is using distraction, using relaxation, using mindfulness. So how we manage the emotions that accompany with the stress. The third one is problem solving. So trying to deal with a problem in a way that is about focusing on what you can do. So finding out information from trusted sources rather than trawling Google and coming across horror stories which actually don't relate to your specific individual diagnosis. And the final sort of coping strategy is a meaning focus. So deriving meaning from a challenging life event. What can I learn from this to help me focus on what's important in my life? commit to what's important to you going forward. It may be that, you know, work is less important going forward and you may go part-time. A lot of people we talk to after a diagnosis of cancer will change their career or will go part-time and do different things with their life. So it's about putting first things first. So the first coping strategy I'm going to talk about is one that I really like and I use myself, which is focusing on what you can control and focusing on what you can do. And this is a real problem solving coping strategy. So get the facts on what's happening to you from trusted sources and really focus on what you can control in terms of your treatment, in terms of getting answers from your medical team, and park what you can't control. So try and cease the rumination and the catastrophizing and the procrastination. And if you feel your mood is dipping in a given day or a given hour, track back and try and work out what were you thinking at that particular point, what is getting to you, and what can you do about it. Also, don't take on too much responsibilities for other people's issues. Everyone's responsible for themselves and for making choices in their lives. So it's important that other people around you take responsibility for how they're feeling and maybe get help as well. Saying no is very important if you are going through treatment. Don't overcommit yourself. You've got enough going on in terms of the treatment and your energy is limited, it's not limitless. So it's really important that you put the boundaries in, be assertive about the boundaries, be clear and straightforward with people, and also accept help where you can. The second area, and this chart just takes a little bit of explaining, is knowing that we have 3 types of emotional regulation system. Majority of people spend a lot of their time in the drive system, going to work, achieving things, pursuing their career, pursuing things at university, at school. So the drive system is very strong. When someone is diagnosed with cancer, they get thrown into the threat system. Sometimes they have to give up work. So we can see that they are then in a system which is very much focused on adrenaline, cortisol, and extremely stressful. Sometimes when people finish their cancer treatment, they rush back to work. So they go straight from the threat system to the drive system. And in terms of how they feel very exhausted, and it can lead to burnout if people go back to work too quickly without a phased return. It also can lead to challenging yourself in being self-critical. You know, I'm not coping. Why aren't I coping now? I'm back at work. So the system that we want people to open up is the contentment system, the looking after yourself, the soothing system, which most people ignore. And this is about protecting yourself, caring for yourself. So we're basically saying this is not a nice to do. It is mandatory that you look after yourself and you put yourself first, particularly when you're going through treatment. The basic needs are important. So making sure you get enough sleep, you get enough rest, you eat a healthy diet, you don't drink too much. And also one of the things that I talk about quite a lot with the groups and on a one-to-one basis is managing the drains in your life. So we will all have people in our lives who give us energy, who are radiators, and those are the people that I want you to surround yourself with, or I want people to surround themselves with when they're going through treatment. But the drains in our life, when we're feeling 100%, that's great to have them in our lives. But when we're going through something like cancer treatment, it's important to manage how much time you spend with those people, so they're not draining your energy because you've got enough going on with the treatment. So the reason this chart is so important is we can create feel-good chemicals and neurotransmitters if we concentrate on doing small achievements, not being overwhelmed by the drive system, and also looking after ourselves with the soothing contentment system. So we can create endorphins through exercise, which help us deal with stress. We can create serotonin through exercise and a healthy diet, which helps regulate our mood. And we can create oxytocin, which also is about being kind to ourselves and compassionate. And finally, dopamine, which is small, manageable achievements, which is the drive system. So there's a lot of science behind this. It is a really useful model to say, actually, in a given week, have I been spending most of my time in the drive system, in the threat system? Have I been spending enough time looking after myself? So it's applicable for people who haven't been diagnosed with cancer as well. The other area, which is a real buzzword at the moment, is mindfulness. Now, with mindfulness, what this is, in essence, is just focusing on the present. When people get diagnosed with cancer, they talk to us about their mind being constantly in the future, about ruminating about what's going to happen in the future, or regretting something they've done in the past. So mindfulness is as simple as trying to be in the present, trying to be in the day you're in, not being judgmental about yourself or others, not being critical about yourself, and being curious about noticing how you feel and not trying to block your feelings. Notice what you're thinking and know that you're not what you're thinking. Your thoughts are not always facts. So that's important to know. Your mind might be all over the place, but they are not facts. And mindfulness doesn't mean you have to do meditation. It can be as simple as finding something you enjoy: walking, cooking, singing, relaxed breathing, gardening, reading, dancing, listening to music. It doesn't have to be that you sit doing meditation. It's finding something that helps you. And in the current climate, many of the people that Rachel and I work with are finding that they're going walking a lot more if they can, or they're just getting out in their garden, sitting in their garden. And I know it's very difficult at the moment with the pandemic, but it's about finding things that we can enjoy. So the last area is, many people talk to us about the fear of cancer coming back, and we liken this to the tale of the sword of Damocles, which is about a courtier called Damocles who was working for the king, and he felt jealous of the king, and he wanted to change places with the king. And the king said, you can, but what you have to do is have this sword hanging over your head from a single horsehair. And he was trying to explain that he is in constant fear, the king, of trying to protect his kingdom, trying to make sure that he protects the people in his kingdom. And some people will say to us that they actually feel the same with cancer, that it feels that it's ever present and it's hanging over them. And that's something that we talk to people about, how to cope with that. So what we would say that it's important to recognize those fears. They are normal to have fears about your mortality. That is nothing to be ashamed of. It's completely understandable. And don't worry alone. Talk to a trusted person about this, whether it's a trusted friend, family member, or a health professional. Try and manage your stress, and that means at work or in the house. See if you can reduce your stress. Try and keep well informed about what to look for in terms of symptoms, and use your healthcare team. The other thing that a lady called Sarah Hughes has talked about is gratitude, finding something in each part of the day to relish, to be joyful, and trying to stay in the day you're in, which again links back to mindfulness. And one of the things that we talk about is trying to get people to live their life rather than just existing between hospital appointments and treatments, because we do find that understandably people are holding themselves together just existing between scans. But what we're encouraging people to do is live your life between these hospital appointments. And I know, again, that's very challenging in the current environment, but it's about finding out what you can do and how you can actually enjoy time with family or friends. So the other thing is, don't spend your time catastrophizing about the future. So one of the things that I know is a challenging thought, but if you worry about it coming back 24 hours a day, 365 days a year, it won't make a difference. So the worry might be a self-protection, but actually it isn't going to make any difference to what happens to you. So we're trying to say, just let yourself off. You're a human being. Worries about mortality and it coming back are normal, but try and work out how you can, move forward, get advice from your health team, and enjoy living life now. So hopefully that's given you a flavour of our work, and you can take something from it. We've got our emails on the screen because Rachel and I are quite happy to have any follow-up afterwards as well in terms of questions. But I'll hand back to Mary now, if that's okay.
Yeah, thank you so much, Kate and Rachel. That is an eye-opening presentation. And like I said before, please put your comments, your questions in the box. If you want to ask live, just use the raise your hand. I think there's an emoji there. Raise your hands and I'll click on you and you can ask your question live. Otherwise, you can just, type your comments or question in the box that says Q&A. All right, thank you so much. There's a lot in there to absorb, to digest, and to take away. Like when Rachel mentioned about head and neck cancer, even as an healthcare professional, I didn't think that far. And I'm sure a lot of us didn't think that far, that patients with head and neck cancer will feel marginalized or neglected when they come to the hospital, because we think, oh, they come to the hospital, they expect to be treated. But there's this, situation where everybody is trying to do what they can, to be safe. So that is really great for us to know and to take away. And also about intimacy. I noticed that in cancer treatment, hair loss, I mean, if anybody was sleeping that's never had any experience or anything like that about cancer before, and you wake them up in their cell and say, what's the side effect of cancer? They'll say hair loss. But now we're talking about intimacy, and I don't think it's something we talk about much. So what I perceive from this presentation is that we need to have maybe another incorporated webinar where we can share some of these things with people. So we talk about cancer and we talk about well-being, in one webinar or seminar, hopefully in the next year when things go back to normal, so that we don't sit in front of the screen for 3 hours. Yeah, thank you so much. And of course, 2 weeks ago, we were talking about, there's a question here, I'll take that in a minute. We're talking about menopause on this platform, and the whole place was like lit up with different things. And you know what, although we talked about surgically induced menopause and other menopause, nobody thought about cancer treatment causing menopause specifically. We know that some drugs can cause it and whatever, but when you now have that on top of dealing with your treatment, I mean, this is where well-being really comes into place. And it's interesting because I'm a convert of mindfulness, actually, Kate. And up until the time I was converted, I always thought about yoga or something fancy. And I had to see a psychologist, and they said, they just showed me something simple, actually. I was ill at work, and before I went back to work, they said, okay, have these couple of sessions. And she said, mindfulness, I think she can read in my face that I'm thinking, oh no, then those simple things makes a difference, actually. And I think we should all embrace that. I'll come to resilience in a minute. Let's take this question. The partners who attend the well-being course, are they of patients both with primary and metastatic cancers?
Yeah, so we do. So that we do an 8-week survivorship course, and they're for people who have got curative cancer, so they're primary cancers. And that particular course is about bridging the gap between finishing cancer treatment and getting back to some sort of normality, getting back into normal life. But then we run separate groups. So we run the group for people with incurable cancer, and then what we found out is that they need to be ongoing, really, because they need to be a group that people can dip in and out of. So we run that group every other week. So we have, quite a few people that come every time, which is absolutely wonderful. But if somebody wanted to come one week, but it didn't suit them for a couple of times, then they can just come in and out, either as they want to or as they need to. And we do the same with the significant others group. So again, that's just an ongoing thing, and people can dip in and dip out as they like.
Okay, does that answer the question? I think so. Okay, there's another question here. Uh-oh, please don't. Okay. Couple of questions in this one. There was a wrong administration of a chemotherapy drug. Instead of giving IV, it was given intrathecally. What risk management plan for this particular chemotherapy drug should be administered? Risk management.
I couldn't answer that. I'm sorry. I wouldn't. I've not got the specifics. It'd be really tricky. I'm not a specialist in the chemotherapy area. I can try and find out if you'd like me to.
Get back to someone, Mary. If we get their email or they email us, we can get back to them on that.
Okay, so they were talking about what quality management approach should be in place. I think this is yeah. And okay, so within that same one, there's another question. So to the person that asked this question, I've got your email anyway. So we're going to get back to you with the right and with the right answer from people who can actually answer that. What is a root cause analysis? What are the major causes behind medication errors and the causes behind medication errors? Yeah.
That's another one we'll have to come back, because that doesn't really fall under the wellbeing. That's a little bit more specific. Yeah.
I'm going to say to this person to join us tomorrow, because there's an oncologist on that panel tomorrow, and there's a nurse specialist for cervical cancer, a colpocosis as well tomorrow. So if you are able to join us tomorrow, I'm going to keep this question and we'll ask that question tomorrow. Okay. 4 minutes. Let me just do this. Okay, there's another question. Can some of the strategies mentioned by Kate be used with children like 9-year-old who worries about his mom's cancer returning? Wow.
Yeah, definitely. So one of the things that can be used with children really effectively is trying to talk to them about, rather than worrying, using their energy to worry, trying to use their energy into what they can help with or what they can do. So they can help with things in the house. They can help in terms of when their parent has to go to hospital. So sometimes I encourage kids to give it what I call a transitional object. Maybe they give a teddy bear to their mom or dad or grandparents to take with them if they have to go in for surgery, or maybe the parent gives the child a necklace or one of their favorite books. And so there is the child being involved. What they can do is help their parent get through the treatment or their grandparent. But what they're not doing is spending lots of time ruminating. They're using their energy to see what they can control and how they can help. The other thing to say is to normalize how they feel, which sounds counterintuitive in a way, but it's also saying, actually, it's understandable that you feel like that. It's not very nice for mom or dad to be poorly, or grandma or granddad. But actually, what we're trying to do is we are having the treatment that we need, and we are doing everything we can, and you're helping us to actually move forward with getting better. But what we do say is acknowledge what children are feeling, tell them that's completely understandable and normal to have some worries and concerns, and also talk to a child in age appropriate language. So we've got lots of guides. We've got a guide which we can pass over to you, Mary, about talking to children of different ages, so different developmental stages, 0 to 5, 5 to 10, 10 to 15, and over sort of that age in terms of older teenagers. And we've got a booklet that we give out to give people advice on different children at different stages of their child development. Also, mindfulness can be used with children very effectively. What do they enjoy? Make sure they're spending enough time on things they enjoy. If they enjoy going to the park or playing football, or they enjoy watching a film with you. So those things are important as well, to get enjoyable activities, and also to keep the routine where you can. So keep them going to school if they can. And I know that's again challenging at the moment, but keep them going to nursery, try and keep their routine and structure, and reassure them, especially if they're younger, that people can't catch cancer, because they might not understand what cancer is. So it's important to say that it's not like a cold, you can't catch it, and just reassure them if they're younger about some of the very basics about what cancer is. You know, it's about cells not growing in the right way. So I hope that helps, but definitely some of the strategies can be used with children.
Thank you very much. That is really important, because with children, sometimes you don't know how much is too much or too little. From my experience as a survivor, I thought I left the relationship when my children were 4 and 8. And eventually I had to leave, because the 8-year-old, when he was 6, was, talking to me, and the 4, when he was 3, is very outspoken. Actually asked me some questions that I thought, oh my God, 3-year-old. But at the end, after we left, the things they were telling me they've been aware of like 3-4 years before, I had to get them counseling.
Yeah.
So with children, it's difficult to know how much or how little. So thank you very much for that, for the question and for the answers. And when we get the information, we'll pass that on. Okay, we've got, okay. I was diagnosed with breast cancer 2 months ago. First, I was told it's stage 2. Then I was called by my breast clinic nurse to tell me it was 3. Then when I went for my 6-week clinic after my result came back from America, the consultant told me it was stage 1, but grade 3. We get this a lot, actually. It was the way it was explained to me. The way it was explained to me was wrong in every way, which caused a lot of stress on me. How can we make sure that the consultants and nurses are explaining to us, make sure they get it right before passing on the news?
I think that can be really difficult, and I can really appreciate how stressful it must be when there's different bits of information coming in. But you get your diagnoses and you get your histology, and there's lots of different information that comes in together. So you can start with an initial staging, and then another piece of information can sort of send it into the blurred lines. So I think it's really, really difficult for people to just be able to come in right at the beginning with a blank answer. It's a tough one.
Yeah. Okay. What feedback do you get from families who are left behind?
So if we're talking about left behind in terms of, does that mean someone who's passed away?
Yes.
Okay. So the feedback we get, we do some bereavement counselling as well with people. And sometimes what they are struck by is when the person has a diagnosis which is metastatic cancer, they start to grieve sometimes for them already. So we call that anticipatory grief, where if someone has a terminal diagnosis, they start to worry that they're not going to live much longer. So that's very stressful at that point. But then when someone does pass away, then it is another secondary loss. And we spend time with people talking about the person who they've lost and all the great characteristics of that person and how they got on with them. We spend time, if there's anything they wish they'd have said to that person, So sometimes people will write what we call a no-send letter to the person who's passed away, to try and write some of the feelings and the things that they didn't manage to say to that person. And what we're trying to do is compassionately help them move forward, but recognizing that they might never completely get rid of that loss, but it's how their life builds around that loss. So that loss might always be painful and always be there, but it's how they then move forward and rebuild their life. And that takes a time, and we call that the fried egg model of grief. So the fried egg model of grief is thinking about the yolk of a fried egg being the loss of a person in your life, a really important person in your life potentially, and the white of the egg being how your life grows going forward and how you actually build your life again. It means that the pain of the loss in the middle of the egg might never go away, but you might be able to build your life around it. And that seems to be a comfort. It's not about grieving and forgetting someone. It's actually about holding them in your hearts and building your life going forward, really. So we spend a lot of time with people who have lost someone. We also get letters from people who, you know, very privileged in our position, who we've supported people who are at end of life, and we get letters sort of saying, thanks so much for, you know, just being there and just being alongside it. Because the other thing is, when people are very poorly, friends and family don't know what to do sometimes, and sometimes people feel very alone at those times. So we definitely move in and help people and support them, and are very much helping them in terms of whatever they need at that point. And I think that's really important, to be alongside people who are struggling. And as Rachel was saying, we run groups for people who are terminal, because they're still people and they should be treated individually and cared for holistically, and we need to support them, rather than feeling that just because their treatment's finished, we should be backing away from them. So I hope that helps in some way. It's a very painful topic to talk about, but we try and support people and be alongside people if they are grieving.
Yeah, thank you so much for that. Okay. Right. How can we remove the stigma around seeking help with well-being and mental health?
How can we remove the stigma? Okay. Yeah. I think by talking about it, being open about it, talking about psychological health in relation to being diagnosed with cancer is completely understandable, that you would have a psychological reaction if you have diagnosis of cancer and you're being treated for cancer. So, you know, bringing it to cancer specifically, we talk to people about, they will go through what we call an adjustment phase, and sometimes we name it as an adjustment diagnosis. So what's happening is their mind and their brain is trying to process a huge threat in their life. And people are human beings, they're not robots. There is going to be a fallout. Your thoughts are going to be affected, your feelings are going to be affected, your behavior is going to be affected. So what we try and do in our work is we say it's completely normal that your psychological health will be affected by going through this life event, this traumatic life event. This is an abnormal life event, but actually it's completely normal. You're having a reaction psychologically. And we offer psychological support in terms of one-to-one therapy and group therapy to every cancer patient that we see, and also to their families. So what we're trying to do there is, and we say this to the consultants and the nursing staff, is this is completely normal, understandable. We would like to see everybody if we can. Some people don't want the help, and that's fine, but we offer the help, because it is nothing at all to be ashamed of. It's completely normal. So we're trying to do our bit in the cancer world to make sure that there's not a stigma around psychological health. And the consultants are very supportive of us. They're obviously helping the patient physically and medically, but what they recognize is that a lot of the pain that cancer causes is not physical, it's mental, it's in the brain, and it's to do with how the mind is reacting to a very traumatic life event. So yeah, so we're doing our bit to try and take that stigma completely out of cancer care. I don't know whether you want to add anything, Rachel, to that.
just think, as you say, talking from the beginning, and we're trying hard to work to get people right at the very beginning, so they know what services are aware, just so we can get the conversation started right at the very beginning.
Okay, thank you very much. There's another question. What support is there ongoing if you are in remission?
So we run the groups, and we hope that people have all got access to the groups from our hospital. There's lots of things out in the community. So there's lots of charities. There's Maggie's, which is a really great charity run support facility. So there's lots of things out there, but our patients are, very welcome. They've got all our contact details. And we always say, as part of the groups, that, it doesn't matter if they finished treatment 3 years ago, they're very welcome to come back. And that if we can't answer questions, we know a man who can, and we'll be in touch with them.
Okay, thank you so much. I have a question. How many centers like yours are available across UK? Because I think every hospital should have this, actually. I know.
It's a really good question. We don't know the exact numbers. We know that in terms of Macmillan and in terms of, the charities, cancer research, people are really pushing on cancer wellbeing and holistic care now. What's been realised is, yes, the chemotherapy, the radiotherapy, the surgery is vital, but the help in supporting people with exercise, supporting people with psychological coping strategies is important, because that's where we can take some of the stress and some of the pain away. And because 1 in 2 people in their lifetime now will get cancer, it's a huge issue and it's very topical. So yeah, I mean, there is lots of people fighting to ensure that cancer wellbeing gets prioritized going forward.
Okay, thank you. Any other questions? Okay, so like I said before, we have a webinar tomorrow on breast and cervical cancer. So I think some of the questions that you may have, you'll be able to ask tomorrow as well. There's a breast surgeon who is also an oncoplastic and reconstructive surgeon. There's an oncologist. There is a specialist nurse in cervical cancer, and there's another specialist nurse in women's health, generally. So that detail is on our web. It will be at the end when you have a follow-on email. And actually, I can put it in here as well before we finish. And when we finish this webinar, there's going to be a survey. Please answer the survey. We would love to hear from you, because every topic is planned based on the outcome of the survey. So we are here to serve you, and we are here to do the right thing and to actually address things that are relevant and things that will benefit our attendees. And our platform is for both healthcare professionals and health consumers. And I think this is what makes it unique, because you can come as an healthcare professional and learn more, like I've learned a lot, this evening, and you can come as health consumers and have your questions answered. So there's another question here. Okay, so the link is there. Thank you, Naomi. So the link for tomorrow is there in the comment box. You can join us tomorrow. We'll have opportunity for another live question and answer session. So before we go, Rachel and Kate, I'd like you both to give us one golden nugget to take away from all of this that you've told us. Something that we can all hang on to. I got a couple already, so just share one each with us.
Okay. Rachel, do you want to go first?
Oh, thanks, Kate. I think it's just the groups have really shown. People always say that they didn't think it would be their thing, or they were worried about coming, or they're not sure it's for them. And everybody that's been through the group seemed to have found that they've really appreciated and been glad that they opened up and wanted to come and try something. So I guess that's mine. If you're a patient and you're in that position, then go for it and meet other people and see what you can find out.
Yeah. I think mine would be, don't stay alone with your intrusive thoughts, your rumination, your catastrophizing. Try and find someone that you trust to talk about these things with, and that you can communicate openly. That might be someone in your family, that might be someone in your friendship group, or it might be a healthcare professional or a psychologist or a therapist. It's really important that you don't become a pressure cooker and have all these things going round and round internally and have nowhere to talk about them. So that would be mine, is just find some outlet so you can talk about things that are going on, because cancer is very much, as well as a physical thing, it's very much a mental thing.
Yeah. And I think we cannot stress that enough, that it's a mental thing. I think a lot of people look at the physical aspect of it, the hair, the weight loss, without thinking of that part that we can't really see, but that eats one away and can affect the outcome. I mean, we can go on and on and on. I'm just loving this. Thank you so much, Rachel and Kate. I'm sure we're going to have another one. We're going to regroup after this and have another one. And like I said, I'm an advocate of resilience, but tonight I learned that it's not about bouncing back. It's about, having positive ways to deal with the situation. And I think that's very important and easy and straightforward for all of us to embrace. So thank you once again for joining us. For everyone who's joined us in November, it's our 5th year at Zenith Global Health. So you are important to us, you are precious to us. And please stay with us. When we send you the email, mark us as safe, and join us on Twitter at Icon Award, Instagram, Facebook, Zenith Global Health. We've postponed our award ceremony this year, but we'll update you with how it's going. Oh, and I'm pleased to say, drum roll, that Rachel and Kate, the group was a recipient last year. Tell us about your award. Don't be.
Thanks, Mary. We got an award last year for the work we do with the groups for cancer wellbeing. So we got an outstanding team award, which is we're really privileged to get, and we're very passionate about our work, which probably people can tell. So it's very close to our hearts. So yeah, we really appreciate that award.
Yeah, so I mean, that's why we are here. That's what we are for. And like I said last week, I don't want to go over myself, but I have to speak to the advisory board first. But I'm sure everyone that's joined us in November, we need to celebrate with you in a way that you'll know that this is a special month for us at Zenith Global Health. So once again, thank you very much. Please, thanks for a really informative session, and keep surfing. Thank you. Don't forget about the survey. Join us tomorrow so that we can continue the conversation, be part of the solution, bring your question and answers, your questions, and we'll try to answer them as much as possible. Thank you so much, and look out for updates in our newsletter. Okay, thank you. Thanks, Rachel. Thanks, Kate. Have a nice evening. Thank you, everyone.
Thank you.
Bye-bye.
Bye.
Thanks a lot. Bye.
Bye.